Absolutely. Okay, so hello everyone. My name is Cassie A. I am a counseling intern at Robert Morris. I am very excited to be here for the Happy Feet presentations. I think it's a really great opportunity, and I'm going to be talking to you guys about, sorry, being comfortable, being uncomfortable, and medical autonomy. So the first thing I want to do is I'm going to tell you guys about a game. And in your head, I would like for you to think about what game I'm talking about, and then I'll tell you what I'm talking about at the end. So, one person has a message. They turn to the person to their left and tell them that message. Then that person on their left turns to the person next to them and repeats the same message, and so on and so on. And then by the person at the end, they are asked to repeat the message, and usually it's a garbled mess, but sometimes you can put it together. Now, hopefully, you guys thought of the game telephone and hopefully not our healthcare system and talking to a bunch of doctors, one after another, repeating that same information or just hearing the information back about you as a patient and thinking, well, where did they get this from? So, what is medical autonomy? Medical autonomy is the patient's right to have a decision about their medical care without experiencing due influence from their healthcare provider. So that's basically your right to say no. And why does that make us uncomfortable? Because most people don't like to say no to their doctors. They don't like to tell them that they're uncomfortable with the information that they're receiving because they think that the doctors know best. They think that they know the system best, and they're in unfamiliar settings. They are in hospital settings or just even a clinical setting where they don't feel at home or comfortable. You know, those sterile walls and everything that surrounds you. It's hard. So medical autonomy is our right to take things into our own hands and say, I don't like how this conversation is going. I don't like the way that this conversation's going, and I might not want to talk to you. I might want to talk to someone else about this problem that I'm having. So why do we have these challenging situations? Because not everything starts off with us having to say no to something right away. You know, there's always these situations that lead up to them. And there's not one person at fault either. There's the system, there's the doctors, and even patients themselves whenever we're in these hostile situations or situations we're unfamiliar with. But the one thing that we always have to keep in mind next to everyone is that first and foremost, it's important to bear in mind that both patients and healthcare practitioners want a positive interaction to ensure that the best possible health outcome as time spent in consultations is valuable for both parties. No one ever wants to be in a situation where people are uncomfortable, and especially about health. You know, that's one of the things that we as people need to take seriously. As you guys, I'm sure, have all been through. Like, these are situations where you need to have the answers and you need to understand what is going on. So, what can cause these, discomfortable, these non-comfortable situations? Well, let's start with the doctors first. Sometimes there's inappropriate choices of words and phrases due to assumptions about knowledge or age or even education. Lack of planned structures for delivering difficult news or inappropriate setting to deliver difficult news. Like, sometimes we'll have patients who are in a hallway and they'll just hear informations being spoken by doctors as they're walking past. That's not an appropriate setting to have information given to you. Not involving the patient in decision-making process or rushing the patient to agree with a decision plan. Those are some things that we also see in people feeling an autonomy is being taken away. They feel like they're being rushed to make a decision about their health. And, also not being given the resources there and then at the hospital to say, this is what I need in the future. Or, if I have questions later, who do I reach out to? And then also on the flip side, we have the patients. Every patient has their own history, right? We all come into these settings and there's so many other factors that come in our home life, our mental health, our physical health, how we're even feeling that day. And so coming into those situations, some days you might be up here, some days you might be down here, and all of those interactions, they can lead to that breaking point of having a, you know, not great experience with a doctor. So, and at the same time, patients put a lot of trust into the healthcare system and their doctors. Over the decades, we've had so much technological advancement that doctors learn as they're going and they're continuing to learn. They go to school for so many years, they should know how to take care of us. And then we get to the system where they have inadequate resources, documentation, and machinery. And all of these factors, can lead to these difficult situations. Long waits and cancellations are another factor. And this is where, Jen, I wanted to have a little bit of conversation because, as you guys might notice, it looks like I forgot to write anything on this slide. It's because okie dokie. So going back to just thinking about what we were talking about and that game of telephone, telling doctors, one thing and then them having to turn around and tell a bajillion other nurses after that. It gets tiring and hearing the same, maybe incorrect message back or hearing information that you don't necessarily understand and maybe can understand bits and pieces of. Sometimes that gets tiring, but so does constantly repeating yourself to one person after another and repeating the same stories and the same symptoms to a doctor or a nurse or whoever comes in to talk to you next. So what I'm going to talk about now is kind of managing these high emotional situations. Optimally, of course, we want to avoid them, but that's not necessarily always the case. So one of the things that I like to take into consideration is planning interactions in advance. And I know that that's not necessarily always the easiest thing to do, especially with talking to people and being in a people-centered situation where things are very high paced. But I'm going to go through some points that I like to think about and give you two different anagrams that I think are very fun and easy to remember when in these situations. So, to plan an interaction in advance, one of the things that we like to do is to think about how to best deliver or structure your thoughts so that you are communicating your needs and the difficulties that they occur very succinctly. Like you are telling them exactly what is going on, getting right to the point, and paying attention to that nonverbal communication, that you're looking and having that eye contact, that you're, expressing just how much you are feeling with these symptoms or communicating how you're feeling. You want to make sure that the information is understandable at the time it's being communicated, like keeping tone and not getting frustrated when trying to explain something to someone or when they're not understanding it. And then as I get further down the list, a lot of it is a lot more kind of checking ourselves and looking for signs of anger and distress in these situations. We want to kind of keep those to a minimal. And when we feel ourselves in high stress situations, especially with talking to other people, words tend to come out faster than we think about them. So looking for those signs of anger and distress, that redness of our ears or that heat creeping up the back of our neck. And we want to create bridges of communication. We want to explain the difficulty. And if someone's not understanding, trying to find common ground and saying, well, have you ever experienced this? It's not exactly what I'm feeling right now, but that gives you a picture of a starting point of where I'm at. And then trying to focus on the elephant in the room and make it clear to find somewhere that you can meet to have a discussion, hitting those details right on the head and saying, this is what I'm feeling. This is exactly what I need in this instant and not letting up about it. And then if you need the time, focus and debrief the conversation later. Take a break. It's okay to, get results, let them sink in, and then ask about them later, and then not let up about letting them go. So, what I wanted to say is to take a break to bathe. So, I know it sounds funny, but they're two different anagrams that I really like. So, the first thing we want to do is take a break. We want to breathe, rest, empower, absorb, and acknowledge. So, we want to breathe, take a minute to calm ourselves down, and give our brain a break. We want to give ourselves a rest just to think and simmer down. And then we want to empower ourselves. Think of something that will keep you going in the moment, something that in your head is like, okay, I need to strive for this out of this interaction. Or even if you can't see something in that interaction, thinking about, well, okay, at the end of the day, this is what I'm going to have to keep me going. And then we're absorbing what's going on around us. We're taking in the environment and the information that we're receiving, and then knowledge: what happened, what did you learn, what can you do, and how can you express it. That's taking all of those things in and taking that mental checklist and asking ourselves all of these questions like, okay, what happened and what can I do and how is it really affecting me? And then after we take that break, we want to bathe. So the first thing we want to do for bathing is, this is where we're expressing. Breaking is all about internal, bathing is about external. This is how you can express it to whomever you're speaking to in that high tense situation. You want to give them the background. What's going on? What are you feeling? What's going on in your life that you need to bring this up? Affect. How is it affecting you? Like, what is the key piece of this that they need to know? Trouble. What troubles you most about the situation? And expressing that, and then handling it and telling them how you have handled it yourself so far, what has worked, what hasn't worked, and then putting some empathy to it and saying, I'm going to say empathy or encouragement, because it going back and forth with a doctor can be hard. So if a doctor doesn't take, or a doctor, nurse, whomever you're speaking to, I don't want to put that label directly on one person. We want to get empathy back. We want to express ourselves and receive empathy on what we're saying. We want them to understand. And so I think these two are really good in these high tense situations, to just take a break and then express everything that you're feeling. And then this is the end of my, presentation spot. So I have the questions up and I will stop sharing.